Good evening, everyone. I am Varsha Shrivastava from Bladder Wellness Team. I hope you are keeping safe. Please vaccinate yourself and wear a mask when in a public place. Today we are here to discuss about kidney stone. Kidney stone is a crystal concretion formed usually within the kidneys. It is an increasing urological disorder affecting about 12% of the world population. So, in this week, let's unite to raise awareness about the issues related to kidney stone and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for the diagnosis and treatment of kidney stone, today we have with us Dr. Darshan Sharma sir. It gives me an immense pleasure to introduce Dr. Darshan Sharma sir to you all. Dr. Darshan Sharma is a senior consultant urologist at Eurocare Apollo Hospital, Faridabad. Sir has a rich experience in the field of urology and carries out the treatment with utmost precision and efficiency, ensuring that the patient's health is in safe hands. Sir, it is a pleasure to have you in our show. We welcome you.
Thank you. Thank you.
Sir, there are many things that we would like to know about kidney stone. So first we will start with the meaning of kidney stone. What is kidney stone actually?
See, there are two type of stones what patients generally suffer from. I would like to tell this in English and Hindi for the viewers. One is gallbladder stone, one is kidney stone. Gallstones जो होते हैं, they are related to digestive systems and they are made up of cholesterol. Whereas kidney stones are made up of calcium and they are generally calcium oxalate stones. Some are infectious stones, some are uric acid stones. So there are a variety of stones in kidneys that can occur in a patient. So why this happen, how this happen? There is a lot of reasons about it. One is like if person is eating lot of calcium, like milk products. So the chances of having more calcium in body that might be excreted in the kidney, in kidney they might form a crystals, and that leads to crystallization of this calcium with some oxalate and other elements, and they form calcium oxalate stones into the kidney. Other reasons are like dehydration. When person is not taking lot of water, or that plenty of liquids are not taken up by the patient, then patient can develop kidney stones. Hot and humid, arid conditions can cause kidney stone formation. This is again because of dehydration. If the person is working in an open field and not taking lot of water, so perspiration will cause, there will be lot of sweating. So the urine will become concentrated, and this concentrated urine can form kidney stones. It's something like, if we explain in a layman's language, it's like if we take a glass of water and we keep on adding salt, ultimately after some time saturation occurs, and then this salt gets settled at the bottom of the glass. Similarly, in the urine, if the person is dehydrated, this calcium will ultimately settle down in the kidney, and these small crystals will join each other and lead to stone formation. That's how kidney stones are formed.
Okay. And sir, who are more prone to this particular problem? Generally, it happens to men or even women are equally affected by it.
Men are generally more affected. Cholesterol stones, gallstones are generally in women, and these kidney stones are more common in men. However, both genders are can be affected. That's not a like it only affects men. That males, that's not the criteria. Females equally affected, but the chances are that the ratio of affection is 4:1, like 4 males versus 1 female.
And so, generally, which age group is more affected? Usually, the old age people are more prone to this particular problem, or anyone at any given point of time can have kidney stone.
See, most common age group of getting a kidney stone is between 20 to 40 years. But even the child are not spared, old age is also not spared. But the reasons are different in different age groups. Like if a child is getting a kidney stone, the person can have a congenital anomaly in the kidney. Congenital anomaly is like the person can have a PUG obstruction. That means the ureter is narrow, So there is more of stresses. There is a hold up of the urine in the kidney, and that can cause stone formation. Patient can have some congenital disorder where the person is excreting more of calcium. The child can have an infection. These are the causes in children. In young adults, it's because of dehydration, taking a lot of calcium, eating fast food, and all these are the causes of stone formation.
Yes, definitely. And sir, what can be the early signs or symptoms through which we can get the surety or we can understand that yes, we might be suffering from kidney stone?
See, one is if there is some contribution of genetics also. It is seen like if the mother and father is having kidney stones, the child are likely to have 10 times higher chances of getting a kidney stone in comparison to the general population. But that is not a mandatory thing. Main thing is the person will be getting pain in the back, that is called flank. It is between abdomen, upper side, below the ribs, and onto the back side. That means it's below the ribs and near to the spine. There, that's the area of pain. Generally, patients develop this pain. Both, it may be on right side because we have two kidneys, right and left. So the person can develop pain on right side also. Person can develop pain on left side also. If the stone is little low, that is down in the ureter. Like if we talk about the urinary tract, it's like kidneys first, then comes ureters, and then both ureters open up in the bladder. That urinary bladder is single, and then comes prostate in males and urethra. If person is having stones in kidney, there are two kidneys, then person can have a pain in right side, on left side. If the person is having ureteric stones, that the stone low down, it's below the kidney and above the bladder, then that person can have a pain in the kidneys and simultaneously pain in the ureter also. Apart from pain, there are some other problems like patient can have bleeding in urine, patient can have burning micturition, he can develop fever, pain, chills, fever with chills and rigors, because these are the symptoms of infection. And similarly, the person can develop bleeding in urine. So these are the suspicious areas where we can suspect that the person might be suffering from stone disease. However, there are the other causes also, like person can have a carcinoma, that is the cancer of this kidney, urinary tract. He can have urinary tract infections. Some other problems, they can also be there, but at this point of time, patient needs further investigation to clarify what he is suffering from.
Okay. So there can be different symptoms through which one can understand that yes, it can be a sign of kidney stone. So this is for all the
Most common,
viewers. Yes, yes, sir.
most common symptom is pain associated with nausea, vomiting, and burning micturition, dysuria. These are the symptoms most commonly associated with stones. And it can vary from place to place. Like if the person is having urinary bladder stone, these people will develop difficulty in passing urine. The urinary stream might not be good. The person is not able to void or pass urine in a single go. Intermittency will be there. If the person is having lower ureteric stone, they will have a pain at the terminal micturition. Let's the end of the urination, they will have a severe pain in the lower abdomen. These are the symptoms that we suspect that the person might be suffering from stone disease.
Okay. And sir, once the person gets to know all these symptoms and he goes to the hospital, but what are the tests which are conducted through which we can get the surety that we might be suffering from kidney stone?
See, they are surety and screening. They are two things. For screening, ultrasound is sufficient, or you can add on with some urine routine examination and other examinations. That gives a fair assessment about kidney person is suffering from kidney stones or not. But there are some chances they can be missed on ultrasound because they are sometimes very small stones. They are stuck up in the ureter that can't be seen by the ultrasound. If the person is obese, these and the person is having a lot of gas in the abdomen, so these are the places where our ultrasound is not 100% accurate. Then we have to take the patient. If we strongly suspect the person is suffering from stone disease, then it is a CT scan, that is NCCT KUB is considered as a gold standard. That is non-contrast CT scan of kidney, ureter, and bladder. That is nearly gold standard, you can say, that can detect nearly 100% of the stone disease. So
Okay.
initially we can talk about if somebody is having pain in the abdomen, ultrasound is easiest, commonly available, most cheap, very minimally expensive. This is the first screening thing that can give us a assessment of kidney stone easily.
So, sir, once all these tests are conducted, after how many days the patient will get the report?
See, ultrasound is the person gets the ultrasound report immediately within 10-15 days. Oh, 15 minutes. Like he gets an ultrasound done right now, it will be printed out and even handed over to the patient. So it's hardly take any time. Urine routine examination take 1 hour, 2 hours. So you can screen with ultrasound and urine routine examination. That is done. Everything is done within less than 1 hour. So person will be knowing that he is suffering from gallbladder stone or kidney stone. That will be within an hour. It doesn't take lot of time.
So this is a good part actually, that the patient won't have to wait for long, and at the right time itself they'll get the proper treatment. So, sir, let's discuss the treatment part now, because many people think that kidney stone in many cases get diluted on its own. So, is it true, or we'll have to go for the proper treatment only?
There are a few myths about the kidney stones. One is beer is a myth. If you take a lot of beer, the stone will be passed. One is myth is they are diluted by some Ayurvedic or homeopathic medications. As per our experience and as per our literature, we have never seen such a thing. Yes, beer causes diuresis, that is more urine production. And once, even if you take a lot of water, that is have the same effect like beer. It's not like if you are taking beer only thing the person can drink 2 beers, 3 beers, or 4 beers at a time. The person might not be able to drink 4 liters of water at a time. So that might be a difference. Otherwise, it doesn't make any sense. Like taking beer is beneficial, and it's you can say fluid intake, if it is more, is equally beneficial as beer. So that produces more urine from the kidney, and that force of the urine can expel small stones at times. Now comes medical management. There are two managements of stones. One is medical management, one is surgical management. If we talk about the medical management, initially, the person who are suffering from stones of 4 stones or 5 stones, you can say stone less than 6 these patients are initially managed conservatively. There is some medications available. If the person is suffering from pain, he will be given some painkillers. There are some medication like tamsulosin, which helps to expel in the expulsion of the stone. Take a lot of water. There are some other potassium magnesium citrate like solutions which are available in the market. If the person takes these medicines, they get symptomatic relief also, and simultaneously small stone can pass out easily with these medications. Uh, there is no medication available which dilutes these stones, except there is one stone which is we call as a uric acid stones, which are formed in the person who are suffering from gout or taking a lot of red meat or these type of things. These uric acid stones, sometimes if person takes a lot of water and alkalize the urine by taking potassium magnesium citrate, these stones can develop or they can dilute or dissolve. But rest calcium stones are not going to dissolve. They are not going to go anywhere without getting proper medical treatment or a surgery.
Okay.
And
And
now
sir,
comes
yes, sir.
yes.
So the medication that we take, there are some of the other side effects also related with the medication. So are there any
Yes,
side effects?
definitely. If you take any medication for a very long time, particularly any painkiller or an antibiotics, they are not to be taken for a very long time. Because analgesics, whatever form, whatever type you are taking, they ultimately affect your livers and your kidney also. So they are going to damage your kidney and liver. So they are not for the unlimited period. We have to see 7 days, 15 days. We have to decide how long we can take these medications. It's not like If person is suffering continuously pain, he's having continuous pain, vomiting, and we are just giving injections, tablets, that is not the solution. If the symptoms are severe, it's better to consult a proper doctor, this is urologist, and then go for whatever the surgical treatment is required. So medical management is initially for 5 to 7 days, 10 days, 15 days in maximum, till the time we are not sure about the diagnosis. And if we know the diagnosis, what is the size of stone, and we are managing conservatively because this is just a small stone. But if it is very symptomatic, person is not comfortable even with taking medications, then it's better to go for stone surgery rather than just wait and watch.
Certainly. So, sir, once the medication the patient has taken and still he is not getting the cure, the kidney stone is still there. So, next step is surgery.
Yeah, next step is surgery. If generally we give, if it is a small stone, like we can differentiate between the size and the position of the stone. Actually, the treatment of stone depends on the size of stone, position of stone, and the composition of stone. So that's how we decide about the treatment, whether the person is requiring medical treatment, whether the person will require a surgical treatment. Suppose if the stone size is more than 10 mm, and if it is in the kidneys or in the upper ureter, upper side of the ureter, then ultimately these patients require surgery most of the times. If the person is having 6 7 mm stone in the lower ureter, just near the exit, these patients can be managed with medical management, and there is a fair chances that they will pass by its own or with the help of medications. But a stone size more than 10 mm is highly unlikely that they will pass with some sort of medications. These people require surgical treatment of.
So, whenever patient hear about surgery or operation, they get really scared because they think that what if the operation is not successful, then they might have to face some other complications as well. So, could you please throw some light on the surgical part?
Nowadays, surgeries are quite safe. Anyway, as the medications have a side effect, so all the surgeries will have side effects also. Uh, every surgery is bound to cause infection and bleeding. That can happen with any type of surgery, irrespective of stone surgery. You go for any surgery like gallbladder, hernia, appendix. These are the problems that happen with all the surgeries. It's not related to one problem, because once you are cutting any patient, making small hole or whatever mode, the person can develop infection and person can develop bleeding also. So these are the two common problems with any of the surgeries. However, the chances are less than a percent chance. Even if we keep on waiting, we keep on waiting, like this stone may pass, even then it can damage kidney and ultimately patient can lose his kidney. Sometimes we see patient landing up with the dialysis, renal transplantation, just because of the stone, ignored stones. So if you are keeping a disease which is silently killing you inside, it's better to get a treatment rather than damaging our kidneys. So side effects of surgeries are much lesser than the side effects of the disease in itself. So we have to outweigh the benefits and losses. So I think surgical treatment is a good option. There are multiple options available for surgery, surgical treatment also. They varies from without hole to small holes. So that depends on the position of the stone ultimately and the size of stone.
Okay. And sir, after how many days of the surgery the patient can resume with his normal routine or start doing the physical work?
Uh, if we talk about surgery as such, we can broadly classify these surgeries into four types. One is ESWL or lithotripsy. Commonly, people call it a laser treatment. Another treatment is URS, that is ureteroscopy. One treatment is RIRS, that is called retrograde intrarenal surgeries. And fourth is PCNL, and some other form like laparoscopic ureterolithotomies and open surgeries also. So depending on type of surgery we are choosing, the recovery is depending on the what type of treatment or what type of surgical treatment we are opting for. If we talk about lithotripsy or ESWL, if I get a lithotripsy today, I am quite fine very next day, and I can go back to my normal work within 24 hours or 48 hours. So lithotripsy doesn't make any hole in the body, doesn't cut anywhere. So there are some sound waves that breaks and cracks these stones, and these small stone can pass the ureter and through the urine. So that is what is lithotripsy is all about. Now comes second surgery, that is called URS, that is ureteroscopy. This is a treatment where lower ureter, stones in the mid ureter and lower ureter can be treated easily with these type of procedures. In this procedure also, there is no hole or cut in the body, and similarly the person is fine and well in 24 to 48 hours. He can resume his work after 48 hours easily. And third is RIRS. Similarly, in RIRS, generally the patient requires 48 hours, 24 to 48 hours. Rest, it depends. If the person is developing infection, some bleeding component, then he might require 1 or 2 days more, but not more than that. Then comes the PCNL, which is little more invasive than these three procedures, where there is some hole is made in the back, and then we go inside the kidney and break the stones inside the kidney and remove it. So this has a little more chances of bleeding. In other three procedures, it is negligible bleeding. In this, the person can develop bleeding. But it's also again less than 1% person can develop a bleeding complication or some problem. But this is reserved for the stones which are more than 15 mm present in kidney, or more than, we have seen 5 centimeter stones, 6 centimeter stone. These stones definitely require PCNL, sometimes multiple holes. So as the disease burden increases in the body, so the surgery intensity increases in the body, so the complication increases. So if we treat the disease early, and if it is small stone, generally we require very, very minimum invasive treatment and very minimum complication. If we have a stone burden of suppose 2 centimeter, 3 centimeter, 4 centimeter, then definitely it will require a little more time to get a recovery. So it depends on what type of surgery we are choosing, how much stone burden is there in the body, and what all other symptoms, like person might be developed having infection before. It's not like infection is because of surgery. It's like person is having infection in the kidney before the surgery also. So once we are operating, actually this infection is going to bound to increase, and slowly it decreases as we give antibiotics and other medications.
Okay. So the best thing is for the patient to consult the urologist, and as and when you're getting the permission to resume with the physical work or the activity, then you can do that. That would be the best thing actually.
Yes,
Yes, sir. Please.
Ignoring the symptoms is not the solution. If you have some problem, it's better to consult a proper doctor. Take a proper advice. If you feel that person is advising surgery, you can take a second opinion. That there is no harm in taking a second opinion while you are opting for surgery, or somebody suggesting surgery. That there is no harm in that. But keeping a stone for more than a month, it generally damages your kidney irreversibly.
Certainly, sir. So from this comes a very important question, and this is for all the viewers. So what generally patients do, that whenever they get any kind of symptoms, they just try to Google those symptoms or ask their friends or relatives, and then they try to find the cure for themselves. And then they just wait for long, and then it is very dangerous for them. So what is the advice for these patients?
So this is a new age disease, that is Googleitis, you can say. People are developing inflammation because of Google. So you can have a knowledge, but first you should go and consult a doctor. Then you can update yourself with his whatever comments he has made, whatever things he has suggested, and in reference to that, you can read in Google or books or whatever you want to refer. But by going initially by Google, you know just the symptoms. They will, if you type one pain, you will get thousands of the disease. Pain is not a symptom. It is not a one symptom. Pain can be because of your appendicitis, it may be colic, it can be UTI, it may be because of gallbladder, it may be because of perforation, it can be anything. It can be because of hernia. So you don't know. Pain is not the criteria of Googling something. You are looking for an answer on internet. That is not the right way of doing it. So sometimes you just Google it, you saw the symptom, you take the treatment, and ultimately you'll end up with some or other complication. So it's better to consult a doctor if you are having severe pain. And then once the doctor, a qualified doctor, once tell something, then you can again Google, you can read, update yourself. That is, there is no harm in updating yourself by reading it. But just by seeing the symptoms and going on Google when you don't have any knowledge of medical field, it's not very an appropriate thing to do.
Definitely. It is very important for all the viewers to understand and the patients to understand that the proper treatment can be provided once you consult the expert and take the proper treatment right at the time. So this is what you all need to keep in mind. And sir, this happens that whenever the treatment is done, the operation is done, are the chances there for this problem, kidney stone problem, to reoccur?
Yes, we have RO in our homes. So RO needs a replacement of your filters every 6 monthly, 3 monthly, or yearly. Similarly, our kidneys are filtering blood day in, day out. Whole day, our kidneys are filtering blood. So once kidneys are filtering, this excess of calcium, salt is bound to go down to the urine, and that can crystallize. So first of all, it's a constant process where stone formation is there. It's not like this. If we avoid some food material for day, or we take a lot of water for even for 7 days or a month or 10 days, 15 days, that is not the solution. Lifestyle modification is the solution, and it is long term. It's not a short term like 7 days, 10 days, 15 days job. If you want to avoid stone formation after a surgery, you have to follow religiously all whatever precautions can be taken up for preventing these stones. Commonly, food items, if we talk about, first, if we see the composition of the stone, calcium oxalate stones are which are most common in 85% of people. So you have to avoid excess of calcium. Like calcium is required for bones also. So you can't avoid calcium, but excess of calcium has to be avoided. Some food materials like tomatoes, brinjals, spinach, dry fruits, all these are the food items which needs to be avoided. And it is a lifelong life. It's not like avoiding for 7 days, avoiding for 10 days, avoiding for a year time. If you again start consuming these food items, you can develop stone again. And other thing is taking lot of water. It's like every hour you should take half glass or a 1 glass of water. You should have a urine output in a daily minimum of 2 liters to 2.5 liters. So actually, if you want to manage medically these stones, it is very difficult. You need a religiously, you have to follow these very religiously. Then you can avoid stone formation. And most of the people forget once they get surgery. After 1 month, 2 months, 3 months, they will forget they had some problem. They will get back to their normal life, whatever they are consuming, junk foods, they are eating whatever they want, taking less of water, taking lot of cold drinks, and ultimately landing again with the same problem, that is stone formation.
Yes, certainly. This is really true that once the operation is done, after some time, the patient, they get back to their normal life and start avoiding their body, and then they don't listen to the symptoms, and then again they come back with the same problem.
Again, they develop the same problems. So it's not nothing wrong about the surgery. Like people say, I got surgery done and I got again stone formation. Nothing to do with the surgery. Surgery is just whatever stone is formed is to remove that stone. If you want a prevention, if some patient requires prevention of stone prevention, then that has to be followed lifelong. It's not a 1 day job, it's not a month job, it's not a year job, it's lifelong. Then he can avoid 90-95% of stone formation, because some congenital anomalies are there that you can't avoid stone. These people are very prone for stone formation, even despite taking all medications, all prophylaxis, all prevention, still they will develop stone, but the chances are in less than a percent, or you can say 5 to 6% of population will have this type of problem. Rest all are preventable and avoidable.
Definitely. So, taking few questions that we have got from our viewers, and the first one is from Pratham. He's asking, sir, is this true that kidney stones can be removed by using shock waves?
Yeah, it's true that there is nothing wrong about it, but first of all, as I told you, it depends on the position of the stone and depend on the composition of the stone and the size of the stone. These three criteria. Stones less than you can say most of the time around 10 mm, soft stones present in the upper ureter and kidneys are quite possible that they can be broken up by the lithotripsy, and they can expels easily without making any hole or cut on the bone. But these are the typical three things: small, soft, and upper ureter and kidney. These are the stones which can be treated with lithotripsy.
And sir, the next question is from Sifa Khan. She's asking, sir, what are the best things or items to drink if I have a kidney stone other than water?
Other than water, you can have anything like any fruit juice you can take. Lemanoids, lemon. These are the good for stone prevention. Lemanoids I'm talking about, not lemon. Lemon is like vitamin C. If you take excess of vitamin C gets into liver and again it forms oxalate, and which combines with calcium and forms calcium oxalate. So you need a little of less lemanoid, like santra, this what is oranges, and you can say mosambi. These food items are okay, but not proper lemon. Lemon causes more stone formation.
So other than water, there are many other items that you can have, you can drink. That
You can take watermelon juice. These are the good juices you can take.
Okay.
High sugar content, again you have to avoid high sugar content because diabetes and all those problems can have some other problems. So water is easy. It's free of any problem. It doesn't have anything apart from water. It doesn't contain sugars. It doesn't contain vitamin C and other things. So water is the easiest thing, cheap and best. Other things are lemanoids, and you can take watermelon type of juices.
Okay. And sir, once the patient they experience the symptoms, as you have mentioned that they will experience severe pain. So, sir, at that particular point of time, what they can do to reduce the pain? Because the pain is really severe, and the meanwhile they are reaching the hospital. Till that duration, what can be done so that pain is reduced?
There are some medications readily available at home. One is most common is diclofenac, that is commonly available as Bovron, Dynapar. These are the tablets that the person can take. There are some other Dotin, some is Meftal-Spas. These are the routine painkillers. If you have any painkiller like Combiflam, even that may work. Even you have crocin, you can take 2 crocins, and that can subside little of your pain. Crocin is actually not for as a painkiller. But if you don't have anything at home, but if you have a crocin or you have a Combiflam, take that. So that will help you relieve the symptoms till the time you get a proper advice and proper investigation and proper consultation.
So for the time being, they can take these medicines so that the pain can subside for a little while, and then the treatment.
Then they can go and visit a doctor and they can follow the proper advice.
But sir, some symptoms are there which are really silent because the patient come up and say that we have never experienced any kind of symptom and still they get kidney stone. So what can
Yes,
be done for the silent symptoms?
there are quite a few patients which have asymptomatic kidney stones also. Generally, these people get ultrasound for some other reason or a preventive health checkups, and then they find a kidney stone, big stones in the kidney, not causing any pain. There are some patients, but they are very less in number. So if somebody is getting preventable health checkups that is also advisable at the age of 35 or 40. You can get an ultrasound once in a year or once in 2 years, something like that. So that can be detected. But in my opinion, most of the time people have some pain. Most times it is ignored by the patient in the name of having gaseous distension, gas formation ho gaya hai, so I am having pain because of this. So most of the time what we find, people develop some or other type of pain, maybe less, maybe more, ignored initially, and after some time, because kidney is such a organ, once they are subjected for initial pain, and after some time pain subsides, pain doesn't occur again, and slowly that stone damages your kidney. So it is, I think ultrasound is very cheap, readily available. It's the best investigation what any person can have once in a year or once in 2 years, even asymptomatic.
Okay. So the silent symptoms are also there. So the patient need to be really, really careful. Even if they feel anything which is abnormal, so they just should go and consult the urologist. That could be the best thing possible that they can do actually. And sir, apart from the food items that we have discussed, that we should drink a plenty of water, what are the food items that we should avoid actually that can be directly linked or indirectly linked to kidney stone?
See, generally, if we talk about there will be at least 20 food items. So everything needs to be taken in moderation. It's not like you totally avoid those food items. If I'm talking about like milk or milk products, you can take one glass of milk per day. You can take curd, you can take uh, cheese, but that should not be in excess. If you are taking a non-vegetarian food, even non-vegetarian food causes stone formation. So you can take in a little amount, not in like big quantities, more quantities. That is harmful. Small quantities of everything can be taken easily. It doesn't need complete stoppage of some food like brinjals, spinach, tomatoes. It is not like this. But excess taking of tomatoes, excess taking of these food items will ultimately land you in stone formation. But take in moderation. Don't avoid it. That is my advice. Don't overindulge in these things once you have a stone problem.
Definitely. Taking the things in moderation and keeping a proper check in your diet is something really important that everyone needs to do, whether they're suffering from kidney stone or not.
Some other problem, even that's true.
Yeah. And sir, if the patient ignores the symptoms or suppose the treatment is taking place, so is it possible that the kidney stone can affect the other organs also?
Generally, if we talk about if there are some ureteric stones or kidney stone, that damages kidney. If kidneys are damaged, kidney has many roles in the body, not apart from the urine formation. The role of kidney is having blood. It secretes erythropoietin, that is one of the hormones that makes RBCs, or you can say keeping your hemoglobin up. It has a role in vitamin D also. So there are other roles of kidneys. It's not about only about urine. So if somebody is developing one problem, he will end up with some other problem also. So otherwise, if somebody is developing kidney infection, that can definitely cause harm to the whole body. It's not limited to the kidney, because anyway kidneys are part of body. If something wrong is happening with the kidneys, definitely other organs will be affected sooner or later.
Definitely. And so, in the end, what is the message for all our viewers who are listening to you so patiently and trying to understand about the kidney stones?
My advice is, if you have a stone more than a month, or if somebody is very reluctant about going for a surgery, maximum wait for a 2 months, not more than that. If the stone size is more than 10 mm, better to go for some or other form of surgical treatment. Once you get your stone removed, then follow the proper preventive advices like taking lot of water, moderating your diet, and lifestyle modification. Sedentary habits causes more stone formation. You should go out, have some exercises. So these are the things that person can do after, once the person is having stones or he got a surgery once in life. So he can avoid recurrence of the stone by uh, having good lifestyle. Still, it's not like I have got a stone surgery today, again I develop the symptoms, I am fed up of the surgery, don't go for surgery again and again. Truly nobody wants surgeries again. But if you have, because ultimately if you keep on ignoring these things, your kidney will be damaged beyond repair, and once your kidneys are damaged beyond repair, then the treatment for that problem is much worse than the kidney stone disease, like going for dialysis or a renal transplant. Not only they are expensive, they make the life miserable at times, because you have to visit hospitals a lot, dialysis twice a week, renal transplant, lifelong immunosuppression. Somebody has to give you kidneys. So it's better to treat this problem at the initial stage rather than making it as a irreparable loss at your end.
Definitely. So, thank you so much, sir, for such a valuable session. It was indeed very much informative for all our viewers. Once again, thank you so much, sir.
Thank you. Thank you.
And thank you to all our viewers for being so patient and asking all the questions related to kidney stone. I hope you have noted all the important points. We'll see you all soon in the next session. Till then, you can follow us on our FB page. You'll find us by the name of Bladder Wellness. You can also follow us on YouTube, Twitter, and Instagram by the same name, that is Bladder Wellness. This is your host, Varsha Srivastava, signing off.